Okay, model number 7 is the one that I said is quite a young patient, got congenitally missing teeth. This is a case where we really wouldn't provide a tooth-borne denture. We'd be looking at providing a mucosa-borne denture, and this would be provided to maintain space between these teeth and stop the lower teeth over erupting into these spaces and so on. Sometimes these artificial teeth are just incorporated onto an Essex type retainer, that kind of thing, rather than a partial denture. But this is where we would use the Every denture. So we have trying to establish tight contacts between each abutment teeth, keeping the gingival tissues free, and making sure that the denture is as minimal as possible. And we incorporate flanges onto the buccal aspects to provide some bracing, and then in addition a wire stop's provided to the distal of the molar tooth to make sure that we maintain that tight contact between the denture and the tooth, so that we've got some retention. So it'll look something like this. The acrylic work's been extended on this one a bit too far, but it should be a bit less, and then the wire stop around. But you can see the idea that we've got these contacts between all the teeth. So this is an Every denture. If you were going to do this as a tooth-borne denture, you can imagine all the, following our rules, all the occlusal rests that would be required adjacent to all of these teeth, and then the clasps and so on. You just wouldn't want to be doing that for somebody who's so young. Okay, if you were to do a partial denture for this pattern of tooth loss on somebody mature or whatever that's wanting a tooth-borne partial denture, then we'd have our saddle areas like so. With regards to support, we'd want support either side of the saddle areas because they're bounded saddles, something like this. Cingulum rest here, cingulum rest here. Now we might compromise and just have something very minimal going on to the central incisors there. And then we'd be on the surveyor looking for undercut for clasping. We really want clasps right at the front of the mouth where possible, but I'd be inclined to put clasps on this tooth like so, and then possibly on the canine here as well, and then we can link all this up together as minimally as possible, something like this, or a full palette type design, or a ring design, whichever we think is going to be the most comfortable really. But you can see it's not a very nice partial denture to have in place. Hopefully this would be retentive enough, because we've got indirect retention acting for these anterior saddle areas. So when this gets displaced, we're going to be rotating about these clasp tips, and these occlusal rests here would act as indirect retention. But yeah, not very nice really. Okay, so that's model number 7. We'll have a look at model number 8.